Hello again. Welcome to the City of Fredericksburg's weekly COVID-19 update. I'm Mike Jones, Fire Chief and Emergency Manager. Well, our good news continues. We move forward again this week, seeing our amount of community transmission drop, the percent positivity drop, and the number of cases in the hospital with severe illness drop. Those are all good signs. If you remember, about 5 weeks ago, we were around 45% positivity on the 7-day average. We're now down to 13.7%, and that's good news because we've been dropping every week since then. Also, the number of people in the hospital back then was 216. We're now down to 43 people in the hospital, so that's positive as well. The number of new cases per week is dropping as well, so we've certainly seen the peak of the Omicron variant, and we're starting to head downwards now. But we still have high community transmission. So what does that actually mean for us? What it means is there's still a high evidence of COVID virus in the area, in the neighborhoods and things like that. So what can we do about it? Can we get back to normal, or when are we going to get back to normal, Chief? And the answer is eventually we will get to the point where we learn to live with this and it becomes endemic or something that we've learned to live with. But right now we're still in the pandemic phase, and we'll be in that way until the people from the CDC and the WHO and those other doctors tell us that we're starting to move to the endemic phase. So what can we do? Can we get back to normal? Well, the answer there is if you're fully vaccinated. And what we mean by fully vaccinated is the fact that you've had either 2 doses of Pfizer or Moderna, or the 1 shot of the J&J initially, and you've had a booster dose, then you're considered fully vaccinated if you're eligible for that booster dose. In that case, can we do certain things? Yes, you can. You can go out, you can be amongst people outside and things like that. You can go inside in different places. Just when you're inside, remember, unless you're eating or drinking, make sure that you wear your mask if you're going to be in an area of high transmission, which the Rappahannock district is. But can I go and eat in a restaurant? Yes, you can go and eat in a restaurant. Just try to choose a time of day where it's not as busy, like the lunch or the dinner rush hour type times. And then the other thing is choose a seat away from other people. Can I go to a movie? Yeah, you can go to a movie. Just make sure you might attend a matinee where it's less crowded, and then try to distance yourself from other people in the thing, as far as the theater. But again, remember that the big thing here is keep your distance, wear your mask indoors, wash your hands, and if you're sick, stay home. That's the key. Let's talk a little bit about vaccinations. The vaccination clinic, community vaccination clinic out at Carl D. Silver Parkway, 1877 Carl D. Silver, is still open. They still have appointments available. You can still walk up and get your vaccines done. You have the choice of the Pfizer, the Moderna, or the J&J. So that's still open. The community testing clinic out at Fred Nats Park, Jackie Robinson Way, has actually closed. They are no longer open because the business has dropped off since the fact that we have less transmission in the area, so that is closed. But you can still get testing done at any of the local pharmacies. Just sign up in advance, or you might be able to go to your primary care provider or an urgent care clinic to do that. Also, every Wednesday afternoon from 4 to 7 p.m. at the Stafford Hospital Center up at Stafford Courthouse, they do community testing. That's the PCR type testing. And they will be doing testing on selected days at the Ladysmith Rescue Squad and also the King George Community Center. And you need to check the Rappahannock Area Health District's website for those dates and times. They're usually on Fridays. But things are moving forward. We're getting better. Just make sure you continue to do the mitigation standards. Wash your hands. Keep 6 feet away from people. If you're in a public place, wear your mask. If you're sick, stay at home, and try to isolate from those people in your household that are sick, that have COVID. But things are starting to look better, and things are starting to move forward. Let's hope we continue on this trend. We'll talk again soon.